Thank you for joining us. We wanted to just come and provide some general updates on our preparedness and our response and where things stand. First of all, we currently have 49 confirmed cases of the coronavirus in the city of Hartford. As everybody has said, and I think it's important to say, that likely represents just a small fraction of the true cases that are out there, and that's why it's so important that everybody continue to honor the social distancing requirements and requests, take that very, very seriously. The most important thing that all of us can do is still the simple stuff, to wash your hands, to stay apart from others, to take the governor's stay home, stay safe order very seriously. And if you have symptoms or if you have questions or concerns, to stay home and to call your healthcare provider or the Hartford Hospital hotline, which is 860-972-8100. I'm going to update on a number of topics and then ask the superintendent to do the same, and then happy to take any questions. As you know, one of the things that we've highlighted a couple of times as an area of concern and one of our priority areas of focus has been reducing the density of our homeless population within our shelters and reducing the vulnerability of our shelter communities and of individuals in those shelters. We've taken a number of steps to do that, and I'm going to recap some of them here. First of all, we have now moved about 75 individuals from shelters to hotels. We started with individuals that were elderly or had underlying health conditions. We then moved to move those who were more independent and who were less in need of the staff support that they get on a daily basis in our shelters to hotels as well. So in those two categories, there are about 75 individuals who have gone from shelters to hotel rooms. We have also worked very, very closely with our shelter providers and with the Coordinated Access Network to take measures to de-densify the remaining shelter population, and that includes a number of things. One, all of our shelters now have an isolation space within the shelter where they can place any individuals who they're concerned may be beginning to show symptoms. We also have set up a quarantine facility with an additional backup quarantine facility if necessary. So we have 10 beds at the Willie Ware Community Center, and we have additional beds over at the Governor's Foot Guard Armory. We have already placed our first individual in the Willie Ware Center. It's an individual who had been homeless, was identified as being COVID positive, and is now in the Willie Ware Center. But in addition to that work to isolate individuals who have tested positive or are showing symptoms, we have also worked with our shelter providers to ensure that there are no more than, currently, no more than 25 individuals in any one undivided space or any one floor of a shelter facility, and also to ensure that there is at least 6 feet between each shelter bed. We hope to get that number down to no more than 20 individuals in any undivided space or any floor, and we think we'll be there as of Monday. We're continuing to work to move additional individuals from shelters to hotels. The balance that we're trying to strike and what we're trying to be very, very conscious of is that many of those individuals who stay in our shelters have a significant need for support, for staff support, and there are risks associated with separating those individuals from the supports that they rely on a daily basis. So we are working hand in hand with our shelters to strike that right balance. But right now, I think we have achieved our first goal, and we're going to continue to work to do even better. With respect to the city's warming center, we've also made some significant changes. First of all, the warming center was scheduled to close on March 31st. It's always established as a seasonal shelter that is meant to provide life-saving warmth in the cold months. We are keeping the warming center open at this point indefinitely, but it will be for a while, and we are shifting its operations. Starting next week, we will be operating that center 24 hours a day, and it will operate more like a normal shelter. So about 40 individuals who have been regularly staying at the warming center will likely remain at that warming center. And again, it will be open 24 hours a day to minimize the number of people who are coming in and going out. We have established another auxiliary shelter space at Asylum Hill Congregational Church, and we are working with Phillips CME to establish an additional auxiliary space in the event that we have needs rising. But right now, we're not seeing the need on a daily basis exceed our capacity. And at the warming center, which is Milner School on Vine Street, there are no more than 20 individuals in any one room. So 40 individuals broken up into 2 different spaces in what was formerly Milner School. We have also decided to keep our overflow shelter for families and children open beyond March 31st so that we can give staff additional time to ensure that those families and children who are in that shelter are gotten into the pipeline and into more stable housing before that closes. So that's a quick update on the many measures we're taking to reduce the vulnerability of our homeless community, to reduce the density of shelter residents in our shelters. And I should also say that we have established a protocol with our hospitals, our Hartford-based hospitals, so that they will notify us anytime an individual who is homeless or believed to be homeless presents with symptoms or tests positive, so that we can ensure that that individual is not going back into a shelter space, but rather going into the quarantine facility at Willie Ware or ultimately at the Governor's Foot Guard Armory. On a couple of other fronts, we have updates as well. We are working closely with the University of Hartford to finalize an agreement on the use of dormitory space to provide housing for our first responders, for those first responders who choose not to go back to their homes because they're concerned about exposure for their families. We don't have a final number on how many that will be, but we have surveyed our first responders as well as those other individuals who are doing work that may potentially expose them to the coronavirus. For example, those who are staffing the quarantine center at Willie Ware. They will also have the opportunity and the option of staying in that space once that is finalized. With respect to child care for our first responders and for our healthcare workers, as of next week, the Highland Early Learning Center will be open as a daycare facility for healthcare workers working at Hartford Hospital. And later this week, the Asylum Hill Early Learning Center will be open as a daycare center for first responders from the city of Hartford. We continue to work with our partners at the hospitals as well as within our own team to ensure that any needs are met. We have also been in close touch with the UFCW and talked with them about providing additional space to their members who are working as grocery store clerks, which I think we all should recognize as vitally important, performing a vital public service right now by staying at work and doing what they do. Finally, we have activated the Medical Reserve Corps in partnership with the state, seeking volunteer effort of individuals who may have previously served as nurses or doctors or others who can provide support. Now, before I turn it over to the superintendent, and then we'll turn it over to Liani for some words in Spanish, I just want to say a couple other things. One, the Hartford Public Schools team has done an outstanding job of working at an unprecedented speed to do an unprecedented thing. Over the course of last week, the Hartford Public Schools distributed about 10,000 laptops or Chromebooks. We also deployed to 16 food distribution sites, and we have seen the number of meals distributed from those sites rise every single day. And so I just want to say how grateful we are to the entire team at the Hartford Public Schools and for the partnership as we've worked together to accomplish those two very, very significant things. As you may know, last Friday, we also distributed nearly 40,000 pounds of fresh produce from 3 of our meal distribution sites. That's because of a partnership with Food Share and because of generous donations from Cisco and Fresh Point, which is located here down in the South Meadows. We're going to continue to look for opportunities to do that. We know that staying healthy in these times doesn't just mean staying apart from one another. It also means maintaining access to fresh, healthy foods, and we're going to continue to do everything we can to facilitate that. As an example, today we distributed about 150 meals, boxes of produce, excuse me, to one of our Hartford Housing Authority sites, and those were also boxes of produce that had been donated, and we're going to continue to look for opportunities like that everywhere we can. With that, let me turn it over to the superintendent, again, with a big thanks to her team and to the partnership, and then happy to take any questions later. Superintendent?
Good afternoon, and thank you, Mayor, also for the partnership and the ongoing support that we continue to receive in Hartford Public Schools from you and from your team. Just some updates from Hartford Public Schools, knowing that we remain committed to making sure that our students have access to nutritious meals every day. As the mayor referenced, we did provide last week 95,000 meals to our students. It is an operation that will continue, and when he speaks about the entire operation at Hartford Public Schools having to move really fast, that is exactly what is happening, not only in response to the basic needs that we must meet from our students in terms of meals, but also with regard to continuation of learning. Today marks the launch. We launched today our continuation of learning plan, a distance learning plan that has two elements to it. One is e-based, electronic-based, internet-dependent accessibility, and the other one is technology-free. I'll speak to the e-learning aspect of it, because we seem to have moved tremendously since we launched 12 days ago, when I told my team that we had to establish a district-wide distance learning task force. Just 12 days ago, we did not have a plan, and today we're launching. And as of Friday, when our staff was deeply engaged in learning, new learning, there were 1,100 Google Classrooms that were created. Today, we have 4,068 Google Classrooms that have been created. 90% of our teachers are in their Google Classroom, have created their Google Classrooms, and as of Friday, 43% of our students had accessed their Google Classrooms before our launch today. And that's a special number for us to pay attention to, because 43% of our students means that over 60, right, close to 60%, have not accessed distance learning via the electronic pathway that we have. And so it warrants for us to step back and identify how is it that we are going to bridge that significant gap that we have. We know that there are families that don't have access to technology, and we will continue. We will move whatever mountains we have to move to make sure that our students have the access, one, to the device, and two, to make sure that their caregivers at home also have the supports that they need to support our students. So that's work that continues to happen in the days to come. I do want to acknowledge the entire team at Hartford Public Schools, our teachers, our administrators, and all the other support staff, just so that I can give you some specific examples as to how everyone, 3,200 staff members at Hartford Public Schools, are part of this endeavor. We have a team of 80 that has been developed so that they can troubleshoot, because we have had, since Friday, about 2,000 inquiries that have come in through either our help desk, our ticket system, from our parents, from our staff, from our students, with regard to supporting them throughout this process. And so at each school site, we have a team of 2 that is specifically designed to support not only teachers, but our students. This feels like it is impossible, and we're doing it. And so I know it is not impossible, it just feels that way. And so I have to acknowledge the hard work that continues to happen. With regard to not having devices for all of our students, we continue to do that individualized outreach to our families, and also engaging in the conversations. I am grateful for all of the partnerships and the support that has happened thus far. I am confident that we will be able to meet the needs of our students, and I want to thank in advance all of the partners and the funders that we've had conversations with, and we're in the process of identifying how it is that we're going to get those technology devices and access to our students. The work continues. I do want to highlight the fact that our staff are amazing, and it is what is inspiring us as a central office team to keep this work going. We miss our students, we miss being in schools, we miss the sound and the feeling of schools. We can't wait to get back. We're not sure when that's going to be, but know, students and families, that we will continue in partnership, not only in Hartford Public Schools, but with our partners here at City Hall and our community-based organizations. We will continue to do everything that we can to meet the needs of our students. And I'll be available for questions after.
So why don't we take questions first, and then I'll ask Liani to add anything that she'd like to add, as well as providing some messages in Spanish, and Chief as well, if you'd like to add anything. We'll start with some questions, yeah.
Are you guys preparing for in-class learning may not resume until next fall?
So I don't want to speak for the superintendent. I think everyone's assumption right now is that we should all be preparing for the fact that we're not going to return to normal for quite some time.
The answer is yes. When we launched the strategy for distance learning, the directive for all of us from me was that we were plan out 10 weeks out so that we can develop our modules for all of our students through the end of June.
How impressed are you with the community stepping up? I mean, all the donations, the laptops, and you had pretty amazing what you have done.
Look, I think our community has stepped up in so many ways, in the small but vitally important ways of just reaching out to neighbors, checking in by phone, picking up groceries for an elderly neighbor who you'd like to, keep from having to leave the house, as well as those big contributions from our corporate partners, from foundation partners. There has been a tremendous response from our community across the board. And I would also say, I think with maybe a few occasional exceptions, I think our community has really taken the social distancing guidance seriously. And that's vitally important, and we're grateful to our community for doing that, because that is something that protects all of us. And when we ask people to stay home, we're not just asking them to stay home for their own safety and health, but for the safety and health of everybody around them, including those who are most vulnerable.
It is very affirming to know that our community is here. It's not that we didn't know that before. We at Hartford Public Schools, that is one of our priorities, to make sure that we are working side by side with our community partners. It is refreshing and affirming when, at 8:30 this morning, I'm talking to Paula Gilberto from United Way and trying to troubleshoot around how can we create structures to support our families, the families of our most vulnerable learners throughout this entire journey. And so it's affirming and validating, not only for us as Hartford Public Schools, but should be for also our students and our families.
Some health officials have noted that there may be another peak of COVID-19 come the fall. So in terms of school, are you guys, is it too far out, or are you guys planning, if you can't return to school in the fall of 2020 as well?
So this has required the entire operation to shift the way it's working, and so we are being very mindful of how is it that we can sustain some of this processes and protocols beyond the crisis that we have in front of us. We know that, look, in all honesty, Hartford Public Schools has been late to the game or to the practice, to the pedagogy with regard to distance learning. Right, the resources have not been there, the infrastructure has not been there, and yet we're here, and we're called to, stand up and figure it out. And so we're going to leverage the opportunity that we have in front of us, because we know that our students learn in a variety of ways. And so we are looking to see how is it that 20% of our English learners can benefit from this new way of learning. How is it that we can really now make learning accessible to all of our students? So we are thinking beyond the crisis that is in front of us.
The learning center continue to operate the way it is planned to operate next week, even under the governor's
So, Liani, feel free to jump in on this, but the governor's order also sets out, we have been working for a while to shift individuals out of shelters and to deconcentrate or de-densify the shelters themselves. The governor's order sets out a goal or requirement for how much space is between each individual in shelters that remain open. And we, at this point, believe that we are already exceeding that requirement, including at the warming center. So the requirement speaks to the amount of space between each bed. We're not only focused on the amount of space between each bed, but also the number of people in any one room or any one floor of a facility. So at the warming center, as an example, where we were originally operating in one big space. And as you know, we expanded the capacity of the warming center to its highest level ever this year to meet the need. We were serving at times as many as 80 people. We have reduced that down. Thankfully, the weather has also helped to reduce the need there. And we've now opened to 2 spaces rather than 1 within that facility. That allows us to serve those 40 individuals in 2 groups of 20 and to be beyond the requirement, above the requirement for the amount of space between each bed. That said, as I mentioned before, we're going to continue to try to look for every opportunity to move individuals into other types of shelter, other types of housing, keeping in mind that in many cases there is a very high level of need for support, and that in some cases includes mental health needs and other needs that are supported by staff, particularly at other shelters, not just the warming center. So it's striking that balance. But in terms of compliance with the governor's order, we've been working hand in hand with the state, and we've been working on this effort for quite some time. And we're gonna continue to work on it. I will add that the governor's office and his team has been a tremendous partner as we work to get that first group of individuals who are most vulnerable, our elderly and those with underlying health conditions, into hotel rooms. That was a joint effort, and this continues to be a joint effort every day between the city and the state, between the city and the Coordinated Access Network, and directly with our shelter operators. It's possible. It's possible. Again, for those shelters that serve a shelter population consistently with high needs, I think everybody is very, very conscious and sensitive of the balance. We don't want to leave individuals who depend on that support, and in many cases depend on those very personal relationships with the staff who provide that support. We don't want to leave them without that support. We want them to be successful. And so we are working hand in hand with every shelter, and every shelter, I think, is working on a very individual basis to figure out the best option for reducing the vulnerability of their own community without creating new types of vulnerability for their residents. Leon, anything you want to add to that, or anything that you want to correct?
So I think it's really important to know that our warming center serves individuals with high levels of need that oftentimes have previously been unsheltered. And so there's definitely a balancing of the needs of that community that we're serving with the governor's executive order on putting people into hotels. So we want to balance that. So that's why we've been doing the work that we've been doing over the last couple of weeks, and working closely with our partner, the Salvation Army, to ensure that we're meeting the spirit of the governor's executive order, as well as keeping this particularly vulnerable community safe. And with regards to shelters potentially emptying out, shelters are working together very well. We're in constant communication with them. As needs change, there may be some shelters that will decide to empty out because of staffing needs, and work together collaboratively with other shelters. So that's something that is being talked about.
You had 4 officers that tested positive for COVID-19. How are the police and fire departments?
Sure. Currently, we have 9 members of the Hartford Police Department, including those initial 4 who have tested positive. It's those initial 4 officers, as well as 3 who we believe contracted the virus through contact with those 4, and primarily outside of work, and then 2 additional individuals who simply presented with symptoms and ultimately tested positive. So needless to say, and anybody who has symptoms or has tested positive is out and is out for a while. We are still working on determining how long they'll have to be out before returning to work. We're also being careful to leave some number of officers in reserve. As you've seen around the country, there have been some police forces that have been hit very, very hard by the coronavirus, and we want to make sure that we are protecting our force and providing some reserve so that there is additional manpower we can reactivate if we need to. We don't have any firefighters currently who have tested positive. We do have one member of our Department of Public Works who has tested positive, and as you can imagine, we monitor that on a daily basis, and we're preparing, as everybody should, for the fact that those numbers will rise and may rise significantly. It's our hope that if we're successful in slowing this down enough, that we'll never get to the point that some departments elsewhere in the country, around the world, have gotten to, where it really hampers their ability to provide service or threatens their ability to meet the staffing needs. But right now, we're not seeing that. We're preparing for that, and we're doing everything we can to prevent that from happening. And so far, we're doing okay. But again, I think everybody should anticipate that the numbers we're seeing will continue to escalate and accelerate, and there's probably no group of people anywhere who are going to be unaffected. And obviously for those who are on the front lines, responding to calls, doing their work, working with those who may well be infected, you're going to see some additional infections, which is why we are so incredibly grateful to all of our first responders and all of our essential employees who are engaging with the public to provide the vital services they provide. Yeah, Leon, you want to take that?
So we are working through that contact tracing process right now, and we'll be able to provide an update about that tomorrow.
Chief, anything you want to add? Chief Freeman has been quarterbacking our procurement effort to keep track of all of the personal protective equipment needs that we have, and to work with the state and other partners to try to secure that PPE. He and his team have been doing a tremendous job, but like everyone everywhere, we are facing an inadequate supply of personal protective equipment, and we're obviously trying to prioritize the distribution of that equipment to those who are most likely to be exposed. But I appreciate the tremendous work that Chief Freeman and his team are doing, as well as the tremendous work that Liani and her team. And let me just say, across the board, we spoke earlier about how the community is stepping up, and the community is stepping up in a big way. But our team, both at the city and at the Board of Ed, are also stepping up in a tremendous way. And they are being both dedicated and flexible, and in many cases, when everybody is, so many people are being asked to stay home, rightly. Many of our employees are being asked to continue to do their jobs because they're so important, and our team has stepped up in a tremendous way, and we should all be proud. Any other questions? Okay, Liani, do you want to just recap a couple, to the best you can, a couple highlights in Spanish?
Hoy día la ciudad de Hartford tiene 49 casos del coronavirus. El alcalde ha dado un breve resumen de todos los pasos que se han tomado para trabajar con los desamparados que no tienen refugio para quedarse en este momento. Entonces estamos trabajando con todos los refugios en la ciudad de Hartford para mover personas que son de tercera edad o que tengan condiciones médicas o que son más independientes para hoteles aquí en el área. Hoy al día hemos movido 75 personas a hoteles. Luego seguimos trabajando con los refugios para estar seguro que no tengan más de 25 personas en una área que no tenga cuarto, y también que tenga una distancia de 6 pies entre medio de cada cama. También estamos trabajando para mantener nuestro centro de calentamiento en la escuela Milner abierto por 24 horas al día, que eso va a empezar la semana que viene. Pero estamos trabajando ahí para mantener lo mismo, solamente 20 personas en 2 diferentes espacios, y mantenerlos que se queden cerca para no introducir el virus si se puede al refugio que tenemos en el centro de calentamiento. También vamos a mantener abierto nuestro refugio que tenemos para familias, para que el personal que trabaja con estas familias tienen más tiempo para ver si le pueden buscar hospedaje o buscar sitios para quedarse con los fondos que están disponibles del Estado en este momento para este caso. Lo último es que estamos trabajando mucho con el Estado en el sentido de estamos activando un grupo de voluntarios que tienen experiencia médica para ayudarnos con nuestros refugios y también en nuestro sitio de cuarentena que tenemos para personas desamparados y personas que no tienen casas que necesitan un sitio para recuperarse o esperar mientras que tengan su examen de la coronavirus. Eso es todo.
Thank you so much, Leonie. Let me just close by saying that we know how difficult this time is for everybody. And we know that the longer this goes on, the more difficult it is. And for all those who have lost their jobs and been laid off and are now, all those families who now have kids at home and find it even more difficult to do their jobs if the jobs are still there, we all stand together as a community. We will get through this together. I'm incredibly proud and grateful of the way our community is stepping up and supporting one another, and we're going to have to do that for a long time to come. We don't know how long this will last, but it will last for longer than any of us want it to. And the best thing we can all do is take care of one another, reach out by phone, if you can, by Skype or any other way to those who you know who may be vulnerable or may be isolated. And we will continue to do the best that we can and to update you as best we can whenever we feel like we have information that's important to share. But again, I ask everybody to work together, and this will be our mantra for however long it lasts, that we've got to work together to get through this, and the way we work together right now is by staying apart. So continue to do that. We'll continue to share information. Thanks, everybody, and God bless.